talk about surgical diseases of the ear. And move around. The ear is not just a place to hang glasses. There are three parts of the ear that we talk about in ENT. Most people talk about the outer ear and the inner ear, because the outer ear is the part you can reach with your finger, and the inner ear is everything else. We talk about three parts. The outer ear ends at the eardrum, and it's the ear canal. It's the cartilage in the skin, and the bony ear canal of 1/3, and the cartilage ear canal of 2/3, and then the eardrum. And from eardrum to the inner ear is called the middle ear. And this is kind of the business end. That's where fluid collects. That's where we get ear infections. My friends, the neurosurgeons, like to call that the high rent district because there's a lot of stuff going on in there. But this is where the bones of hearing are, and the bones of hearing bring sound from outside the inside world. And then the inner ear, the snail-shaped cochlea, the semicircular canals that have to do with balance, and the nerves that go to the brainstem. So I'm going to be talking about these different parts and what's important. This is what I hear every single day. Doctor, tell me about earwax. I mean, who doesn't want to know about earwax? It's fascinating. And Dr. Schiff, one of my mentors, spent 35 years traveling around the world studying earwax. And if you want to talk about a way to put people to sleep, he had it. It's inherited. It is variable. Scotch and Irish people make a lot of it. Asian people make almost none. And it's definitely heredity. But it is a lubricant. It is anti-infective. And since we have sloughing of the skin cells and these glands in the outer ear canal that make wax, and it kind of pushes all the junk out, it's also supposed to be self-cleaning. But for me, I see people who aren't self-cleaning, and that keeps us all in business as well. Candling is an interesting thing, and when you light something that's paraffin in the ear that's supposed to create a vacuum and suck wax out, I see those people who are burnt, or I see those people whose hair were lit on fire. You need somebody who knows what they're doing if they're candling your ear, and I'm not certain it makes a huge difference. What often is shown to the patient is what's left after the paraffin burns, but not always what comes out of the ear. But this S-shaped outer ear canal is just so that you and I don't push things through our eardrum. If I had a nickel for every time somebody put a bobby pin or a Q-tip in their ear and then answered the phone and punctured their eardrum because they forgot, then I'd have a lot of nickels. But that is supposed to protect us from ourselves, the S-shaped outer ear canal. So what happens when the outer ear canal gets hurt or infected? You get a swimmer's ear. It doesn't always happen when you're swimming. And swimmer's ear, because this is a normal outer ear canal and a normal eardrum, and the landmarks of the eardrum, this is the hammer, this is the anvil, and right here is the stirrup, or the malleus, the incus, and the stapes. And if you look really closely, you can see something that's a little white bump there that's called the chorda tympani nerve that's going through the middle ear. And so that's a normal eardrum and a normal ear canal. When you do dishes and you soak your hands in dishes, my family likes to call it perny hands or dishpan hands, and they get all kind of macerated. The skin is the first level of defense, and if we have a wet, dark place, you can get an infection in the outer ear canal. It can swell shut. And that's really painful. I've had women patients who've had babies and women patients who've had this, and they want another baby because that really hurts. This is one of the few times I write for narcotics. It's usually bacterial, it can be fungal, and treatment's pretty straightforward. Get the crap out of there. So we get the crap out of there, kill the offending organisms with antimicrobials. So sometimes when it's fungus, when I was in the Navy, we joked about people kept treating me like a mushroom because they keep me in the dark and feed me a bunch of crap. So you got to get light in there, you got to get air in there, you got to get the crap out. When people have recurrent stenosis of the outer ear canal, when they have a narrow ear canal, when stuff gets trapped and they need it cleaned all the time, you can use topical antiseptics like vinegar alcohol mixture, which lowers the pH and dries the water, but surgery can open the ear canal, and I'll show you that in a little bit. That's sort of an extreme case. But I have people who get stuff trapped in and they get ear infections every 3 or 4 months in the outer ear. And my mentor, Dr. Hunsaker, who was a Vietnam battle surgeon who used to see swamp ear all the time because going through the rice paddies, everybody got infections in their outer ear, kind of designed that. So that's sort of the outer ear in a whirlwind deal. me know if you have questions. I'm sorry, I forgot to introduce myself. I'm Todd Berinstein, and I pick noses for a living and sometimes ears. ENToffice.org is my practice, and that's just so in case you forget who we are, if you go to ENToffice.org. Hi. We missed the outer ear, but that's okay. We're going to the middle ear. You can catch up. So here's the outer ear. I talked about outer ear infections and outer stuff in the 3 parts. So the next part is the middle ear, which is the eardrum. It's got skin on the outside, mucosa on the inside, and it's got a layer of fibrosis in between. And so it's a 3-layer drum. Sometimes if you look at an eardrum, what you'll see is you'll see something that looks like a hole in the eardrum. This is a reflection of the light that they're working in, but sometimes you can see something circular here, and it looks like a hole, but it's not. That's called a monomer. When the scarring from a hole in the eardrum is repaired, that central part, the fibrous layer, isn't there, so it's see-through, and it's an optical illusion that looks like a hole. But those 3 parts, sorry, I'm a little ahead of myself, of the 3 layers help with the eardrum. The difference between the eardrum, which is about 9 by 13 millimeters, and the footplate of the stapes, which is 1 by 3 millimeters, is a 17-to-1 difference. And so that surface area sound hitting here through the bones of hearing, plus there's a magnification because of mechanics of the bones of hearing, from a big drum to a little drum brings sound in and magnifies it 17 times. So if you have a hole in your eardrum, or you have fluid under your eardrum and it interferes with sound coming through, you don't get that magnification, and that's why I think about the worst cold you have. Somebody's got stuff in my ears and I can't hear. That's what we're interfering with. Nerve loss is different, but this magnification is actually a real deal. If one of these bones is fixed, then that sound pressure that hits the eardrum and comes to the inner ear doesn't work normally, and that's a conductive loss. If the hearing gets transmitted through, but the nerve or the sensory organ, the cochlea, isn't working properly, that's sensory nerve. And so the difference between conductive loss and sensory neural loss tells me what I'm supposed to do to help fix those people. We don't have any medicine or but one operation to fix sensory neural loss. So age-related hearing loss, noise-related hearing loss. You can have a totally implantable hearing aid, which is kind of a cool deal. Little magnets put on here, and a little wire is fed through here, and underneath the skin, like a cochlear implant, a little electronic device is done. It's $50,000. It's not covered by insurance, but for people who are swimmers and who can afford it, it's a great deal. You only have to change the battery once every 10 years. I don't know a lot of things that you do. And now that we can charge things just by putting our phones on things, somebody's coming up with a fancy thing to be able to charge that battery through the skin, so that would be a kind of a cool deal. But hearing aids are what to help the nerve loss, but what do we do when the bones of hearing don't work in this air-filled space? Well, first of all, if there's fluid, think about swimming in a swimming pool, and you're looking up underneath the water of the swimming pool, and you see somebody standing there talking to you, and you can't hear a thing. And that's because sound travels in air. Sound really doesn't travel well in water. And that sound transmission, if you're a little kid with fluid in your eardrums or a person with a cold, that is interfering with the bones of hearing, and that's what can cause hearing loss. So I showed you this picture about the eardrum. Here is a picture of a hole in the eardrum, and putting a patch under the hole in the eardrum is how we